Congratulations, you just became a doctor, 7 years of medical school, 3 years of psychiatric residency. Your parents frame your diploma like it's a museum piece. You're 29 years old. You believe you're going to heal minds. Then you get a job at a psychiatric hospital in 1947 America. That's when you learn what your job actually is. The hospital is overcrowded, patients everywhere, men screaming, women locked in padded rooms. Some have schizophrenia, some are depressed, some are just inconvenient for their families. The chief doctor calls you into his office. He shows you a new revolutionary procedure, a lobotomy. The idea is simple. If someone's brain causes suffering, you remove the part of the brain causing it. The tool looks like an ice pick, because it basically is an ice pick. The doctor places it above the patient's eye. Then he taps it with a hammer. You hear a soft crack. The tool slides into the brain. Then he moves it side to side, destroying part of the frontal lobe. The patient stops screaming. The room goes quiet. See, the doctor says, cured. Your first patient is a 32-year-old woman, severe depression. She hasn't spoken in weeks. The hospital director tells you her husband signed the consent form. You hesitate, but this is the future of psychiatry. You lift the hammer, tap, tap. The instrument slides into her skull. When she wakes up, she is calm. She is also different. Her emotions are gone. Her personality erased. She stares at the wall forever. The hospital calls it a success. Suddenly, lobotomies are everywhere. Hospitals love them. They're cheap. They're fast. They make difficult patients quiet. You start doing 3 a day, then 5, then 10. Depression, anxiety, rebellious teenagers, war veterans with trauma, housewives who talk too much. Everyone becomes a candidate. Your hammer becomes the most powerful psychiatric tool in America. Soon, you're famous. Newspapers call lobotomy a miracle cure. One doctor in particular becomes a celebrity, Walter Freeman. He performs lobotomies across the country, sometimes 25 in one day, sometimes in front of journalists, sometimes without anesthesia. You attend one of his demonstrations. The patient convulses while the tool enters her brain. The audience applauds. But something starts bothering you. Some patients improve, but many don't. They lose emotions. They lose intelligence. They lose themselves. One of your patients used to be a pianist. After the lobotomy, she can barely feed herself. Another forgets how to speak. Another laughs at nothing for hours. You begin to understand the truth. You're not curing people. You're damaging their brains until they stop suffering, because they stop feeling anything. Then the children start arriving. A 12-year-old boy with behavioral problems. A teenage girl labeled hysterical. Parents sign the forms. Doctors approve the surgery. You place the instrument above the eye. Tap, tap, tap. The child stops resisting, and you realize something horrifying. You can change a human personality with 2 centimeters of steel. By now, you've performed over 200 lobotomies. The hospital praises you. Patients are easier to control. Families send thank you letters. But every night you remember their faces. Blank. Empty. You start drinking. Sleeping pills. Anything to quiet your thoughts. Because deep down you know you didn't heal them. You erased them. One day, a young woman is brought in. She's perfectly sane. Her husband claims she's difficult, too independent, too angry. He signs the consent form. The hospital schedules the surgery. You hold the instrument in your hand, and suddenly you realize something. This tool doesn't treat illness. It removes inconvenient people. In the 1950s, a new drug appears, antipsychotics. Suddenly, psychiatry doesn't need lobotomies anymore. Hospitals slowly abandon the procedure. But by then, it's too late. Over 40,000 people have already been lobotomized. Some improved, many destroyed. You spend the rest of your career wondering something. Did you help people or ruin their lives? Because the terrifying truth about lobotomies is this: they worked. Not because they healed the mind, but because they silenced it. And the worst part, for a brief moment in history, medicine believed that was a cure.